Rheumatoid arthritis is exactly that, and science shows it can affect far more than just your joints. What is rheumatoid arthritis? Rheumatoid arthritis, or RA, is a chronic autoimmune disease. Instead of protecting the body, the immune system mistakenly attacks joint tissues, leading to persistent inflammation, pain, and progressive joint damage. Unlike osteoarthritis, RA is systemic, meaning it can also affect organs like the lungs, skin, blood vessels, and heart. How healthy joints work. In normal joints, the ends of bones are covered by articular cartilage, a smooth tissue that reduces friction. These joints, called synovial joints, are lined with a synovial membrane that produces synovial fluid, which lubricates and nourishes the joint. This structure allows smooth, pain-free movement. What triggers RA? RA develops from a combination of genetics and environment. Research consistently shows that certain immune system genes, especially HLA-DR4 and HLA-DR1, increase susceptibility. Environmental exposures, most strongly cigarette smoking, can modify normal body proteins through a chemical process called citrullination. These altered proteins are then misidentified as foreign. The immune response behind RA. Immune cells present these altered proteins to CD4+ T helper cells, which activate B cells. The B cells produce autoantibodies, most notably rheumatoid factor, RF, and anti-cyclic citrullinated peptide, or anti-CCP antibodies. Anti-CCP antibodies are particularly important because they are highly specific for RA and often appear years before symptoms begin. How joint damage occurs. Activated immune cells migrate into joints and release inflammatory cytokines, including TNF-alpha, interleukin-1, and interleukin-6. These cytokines stimulate excessive growth of the synovial lining, form an invasive tissue called pannus, destroy cartilage using enzymes, and activate bone-resorbing cells, or osteoclasts, causing bone erosion. This process explains why RA causes irreversible joint damage if untreated. Why RA affects the whole body. Inflammatory cytokines enter the bloodstream and affect other organs: brain, fatigue and fever, muscles, weakness and wasting, skin, rheumatoid nodules, blood vessels, increased cardiovascular disease risk, lungs, interstitial lung disease and pleural effusions, liver, increased hepcidin leading to anemia of chronic disease. Large studies confirm that people with RA have a higher risk of heart attack and stroke compared to the general population. Typical clinical features. RA usually affects 5 or more joints, symmetrically, both sides of the body, small joints of the hands and feet first. Key symptoms include swollen, warm, painful joints, morning stiffness lasting over 1 hour, progressive joint deformities if untreated. Diagnosis. Diagnosis is based on blood tests for RF and anti-CCP antibodies, elevated inflammatory markers, and imaging showing joint space narrowing and bone erosions. Early diagnosis is strongly associated with better long-term outcomes. Evidence-based treatment. RA treatment aims to control inflammation and prevent joint damage. First-line therapy includes disease-modifying anti-rheumatic drugs such as methotrexate, which has the strongest evidence for reducing disease progression. If needed, biologic agents target specific immune pathways: TNF inhibitors, IL-6 inhibitors, B-cell or T-cell targeted therapies. NSAIDs and short-term corticosteroids are used for symptom relief, but do not alter disease progression. Final takeaway. Rheumatoid arthritis is a well-studied autoimmune disease driven by immune dysregulation, not joint wear. Scientific evidence clearly shows that early diagnosis and targeted treatment can preserve joint function, reduce systemic complications, and dramatically improve quality of life. If this helped you understand RA more clearly, like the video, share it with someone who needs it, and subscribe for more evidence-based medical explanations.